Good morning.
Good morning.
We are going to start this morning about musculoskeletal system, and everybody I gave 3 packages. You have 1 package with musculoskeletal, 1 question, and 1 drugs, all right? So you have drug package also. So if you don't have, make sure you take it. So you should have 3 packages. And very important that we know the bones, we know what we do patients when you're dealing with the fractures and how to take care of them with musculoskeletal system. So I have few things are written here, and you do have on page 1. And remember, the first word is arthrosynthesis. The meaning with arthrosynthesis is what? Arthro word is bone. So whenever you see the word arthroscopy, arthrosynthesis, arthro means the bone. And what is arthrosynthesis? They're removing the fluid. Underline the word aspiration. What is the fluid in the bones we have around the bones? Is called synovial fluid. So what kind of fluid we have? Synovial fluid. And that's the fluid, they need to remove it and by inserting the needle. So it's a diagnostic purpose to know infection, maybe to remove the fluid. So what is arthrosynthesis? Removing the fluid from the bones. And what kind of fluid are we removing is the synovial fluid. So we are removing the synovial fluid. Now also we need to know they can give medication in the bones, which is you have under medication are steroids. A lot of patients, when they have a lot of pain, and they're treating them by giving steroids into the joint. So even if they're giving us steroids or they're doing arthrosynthesis, what do we do with the patients here after or before procedure? Number 1, consent is important. After procedure, all in skeletal system, we are going to use the elastic bandage, and which is your patient after the procedure, you may use it. Ice is always good to reduce for pain and swelling, and pain continues more than 2 days. After they inject the steroids, you need to notify. Rest is important. Any sign of swelling there is, fever, sign of infection, you got to notify. Everyone is okay? So the word is what? Arthrosynthesis. What fluid are we removing here? Synovial fluid. And what do you monitor after the procedure? Infection, inflammation, and pain. Ice is always good, and the bandages you will use is the elastic bandage. Arthrography word. Graphy means picture. Wherever you see the word graphy, that means they're going to use what? Iodine. And so underline the word iodine and check for allergies for iodine or shellfish. Underline that and correct the spelling. Allergies to iodine. So patient is going for arthro. Arthro means bone. Graphy means picture. And what are they going to use here? Iodine. So is NPO is good. What do you teach patient during the procedure is not to move. So in the 3rd line, remain still. So tell the patient, unless they ask to move, on the first page, page number 1, on the skeletal system, arthrography, after the procedure, what do you tell the patient is minimize for the joint for 12 hours after the procedure, and also monitor for edema. You can apply again ice, wrap it with the wrap bandage, or we use the word compressive bandage, and also patient, you decrease their pain by giving pain medication. So everyone is okay. Word arthroscopy word and arthrography word. The scopy word I will be talking now, but synthesis word everyone should know. The fluid is called synovial fluid. And when they're saying what is synthesis, you're removing synovial fluid, either to relieve pain or for diagnostic purpose. Arthrography means is picture. So what do we remember here? Iodine. What do we remember here? Not to move. Tell the patient, unless they ask you for moving, then only you change the position. And what do you monitor afterwards? Again, pain, and rest the patient, is bandage. Now the second page, if you guys will move on second page the word says arthroscopy. It doesn't have a separate, so the second word, you highlight that, that's a procedure. On the next page, arthroscopy. What is the word is scopy? Whenever you're seeing endoscopy, arthroscopy, they're looking inside the bone. So endoscopy. So what is the second word is for arthroscopy means, remember the word endoscopy. Endoscopy means they're going to look inside the bones. And arthroscopy and endoscopy. And what do we need to do here? Intervention, NPO is good. And what do you monitor after the patient come back after arthroscopy is consent is important, NPO is good, and after the procedure you're going to monitor for pain, elastic bandage, elevation. But very important line is here, the crutches. That means after endoscopy, patient is non-weight bearing. Patient is not going to use that side and they're not walking. Non-weight bearing means they cannot put the weight. So question can be, patient is scheduled for arthroscopy. What do you teach patient before the procedure? How to use what? Their crutches. Everyone is okay? No weight after the procedure. That's important. So highlight that word on page number 2 where it says use of crutches. How long they need to use those crutches? 5 to 7 days. Ice is good. Notify the physician if patient has fever or any edema continue more than 3 days. Then you need to be more concerned. Everyone is okay. Arthroscopy, very important. We all should know. They're looking inside the bones. Arthroscopy, endoscopy. And what do you remember before the procedure? It's on the second page, right on the top, the word arthroscopy. Second word on second page, so highlight that. And arthroscopy, very important, that patient is not going to ambulate and they will be non-weight bearing. And what would you be telling them to use the crutches? Did you find it, the word arthroscopy? No, on the second page, right on the top, on the second page, is the second word arthroscopy. Do you see after swelling? You have the pages?
Right here it skips from 1 to 3. So
Oh, you guys are
page
missing
1,
the
page
page?
3.
Can you stop? Arthroscopy is on page number 2, and page number 2, it doesn't say separately, but the second word is arthroscopy. Everyone has now. And what do we monitor for arthroscopy? I want you to highlight the word endoscopy. That means they're looking inside the bone. So when they use the word endoscopy, that means it's inside the body. They're putting the scope to see. And so what do you remember word arthroscopy, endoscopy, and non-weight bearing? So there may be a question, what do you teach patient before patient is going for arthroscopy? So what are you going to teach them? How to use the crutches. Are we clear? You're going to tell the patient they will not be able to put the weight, so they should be using the crutches. And for how long they're going to use the crutches? 5 to 7 days. So you can highlight that word, 5 to 7 days. After the procedure, what do you monitor? Edema, swelling, pain. Anything pain and swelling continue, you need to notify immediately the physician. The next procedure is the bone scan. When you're doing in a bone scan, you're using, underline the word, radioisotope. You're using what? Radioisotope. And is excreted through the body, through the urine and the feces, but is not harmful. So anytime they're using a scan, what are they using? Radioisotope. So let the patient know. Intervention. Hold the fluids 4 hours before the procedure. And second line, you will highlight the word, remove the jewelry. And they give the fluids. After injecting radioisotopes, they got to drink the fluid. And from 1 to 3 hours after patient can void and clear isotopes from the bladder before they do the scanning. So they have to void it. And after procedure, monitor the injection site for redness. And after procedure, you encourage fluid. So let's remember one thing, bone scan, radioisotope. Patient remove the jewelry, patient would drink fluid, and they're going to do is the procedure and drinking the fluid, and afterwards the body fluids are not harmful. So scan means they're using radioisotope. Now I will move on. Biopsy. If they're going to do any biopsy, whether they're doing a bone biopsy, muscle biopsy, second thing is first line, consent is important. After any biopsy we do, what do we monitor? Swelling, pain, but very important, infection. What do you prevent them from infection? Monitor for bleeding, hematoma. Elevate the site. You can always elevate to reduce the edema. Ice is always good. Mild to moderate discomfort is common after the procedure. So everyone remember, we all are nurses. We got to know the procedure, because any procedure can be asked, what would you teach patient and what do you monitor after the procedure? Next word, EMG. EMG is electromyography. When we see the word myo means the muscle. Graphy means they are taking pictures like you do for ECG, electrical pictures of the muscle. So it says EMG measure, and underline the word electrical potential associated with the skeletal muscle contraction, because our muscles are contracting and they're looking how does the muscles are functioning. ECG we do for cardio, EEG word comes for brain, EMG word comes for muscles. Everyone is all right? So electromyography. But very important here for your patient are, you tell the patient, instruct the client, the insertion is uncomfortable. So patient says, how would I feel? You can tell them they will feel some pain and it will be uncomfortable. But what do we hold before the procedure that is important is highlight the word stimulant. Any medication you're giving as a stimulant, you do not give. Any sedatives you give them, you do not give. And why? Because you want to check the muscle. They're functioning without any medication. Everyone is okay. You don't want to stimulate, you don't want to give them is medication to depress, because you really want to see what is the normal contraction and the function of the muscle. So what do we hold before the procedure? A stimulant and the depressant. And what do you monitor afterward is any bruising. Pain, you monitor for pain, and patient asks, do I feel pain? Yes, there will be some discomfort because they have to inject the needle and they're taking the picture. So everyone is okay. The word is EMG. EMG is called electromyography. Very important that we all need to know the word arthroscopy, arthrosynthesis, taking the fluid, arthroscopy, they're looking inside the bone, and I said electromyography. Electromyography is EMG. When you're doing electromyography, is you're not going to give stimulant and depressant. Very important that we got to know that. Next word, you have strain word. And what is strains are a stretching of muscle or tendon. So highlight the word, what is it stretching here? Muscle or tendon. Now management, all your managements are basically you apply cold and also give muscle relaxant because there is a pain. You can give them muscle relaxant and maybe done surgery. If there is the tendon rupture, they may require the surgery. But we must know the word strain is stretching of the muscle or the tendon. Next page, we'll move on. The word is sprain. And what is sprain is stretching of ligament. Caused by, what happened, the ligament is stretched. How? By twisting. You're walking and you have uneven surface. And what happened? You get the sprain. So what is sprain is is the stretching of the ligament. Management, same thing, let the patient rest, apply ice, elevation is always good, compressive bandages are always good, and if that didn't help, they may have to put the cast or to support or maybe require, if really bad ligament have been affected, then they have to get the surgery. So we must know these wording which are important. Now I'm going to move on. The word is fracture. What is the meaning with the fractures are when we have our patients with the fracture? The break in the continuity of the bone. So what happened? Fracture, break in the bone. The bone is broken. In simple word, we would say that is a fracture. But I have it here, and we must know the wording of fracture, because fractures wording is good to know all the types of fracture. Number one, when they are saying simple fracture, what is the meaning simple fracture is the other word is closed fracture. What is the meaning closed fracture? The skin is not open. Are we clear? So write down the word here. The simple fracture is meaning that the skin is intact. Now, if we have a question and we are looking into simple fracture, the main thing in our mind should be is the first thing I will be talking about immobilizing. Now, if you have a simple fracture, what would you do? There's nothing you have to do on the skin. Skin is intact, so you're going to immobilize. So what is the meaning here when we see the patient has a fracture, but what kind of fracture? Before you pick up the answer, what is going to be the best answer? So patient has a fracture. What do we monitor patient here is number one, simple fracture. What is simple fracture means is closed fracture. What is the meaning is the closed fracture? The skin is not open. Everyone is okay? So skin is intact. You don't have to worry about infection. If you have second word, see how your word changes and how your answer would changes. Now the question is compound fracture. You've got to remember whenever there is a question, compound fracture, what is the meaning here is underline the word skin surface is open. So now what is open here? A skin. So what is it open? A skin. So remember, whenever the skin is open, what would lead to? Infection. So here you have to deal differently. So immediately when you start dealing with your patient, we got to know what kind of patient has a fracture. So when you're looking and answering your question, simple fracture, no risk for infection because it's closed, the skin is closed. But second line, you have compound fracture. What is the meaning of compound fracture? The skin surface is open or broken, and the risk is what? Infection. What is the risk of fracture? Or remember, I will be talking later on, is osteomyelitis. Everyone is okay? What is osteomyelitis? Infection of the bone. So what is one of the big problems with the patient with fracture? Osteomyelitis. How do you prevent them? Before you do anything, first thing now, you got to clean the skin. I will talk on the treatment. Number 3 is called comminuted fracture, and I want you to add there, the word is number 3, a splintered fracture. Sometimes they use the word a splintered. When you see the word splinter or comminuted fracture, it has pieces. They have few pieces in the bone, and comminuted fracture has damaged the nerve and the blood vessel. So it's more inside the blood vessel, and splintered fracture means would be in the pieces. Number 4, green stick fracture. When you have a green stick fracture, underline the word, is common in children, and bone is broken and bone is bending on the sides, on one side. So bending of the bone would be your green stick fracture. Number 4 is your green stick fracture, and number 5 is very important. The word is pathological fracture. What is the meaning pathological? If you will see this word pathological means your patient bones are very weak. Why? Osteoporosis. Maybe patient has cancer, so underline the word osteoporosis. Osteopenia word, also write down there. So remember, osteopenia is also weak bone. Osteoporosis. Patient has cancer. Patient has too much of calcium in hyperparathyroid when I talk about endocrine system. And what happens when you have too much of calcium in the blood is you're not getting enough calcium. You guys already have osteoporosis. You already had the last word correct here, cancer. And add there osteopenia word. Osteopenia is same osteoporosis. The bones are weak. So remember, if they give you, patient has history of pathological fracture. Or pathological means is the bones are very weak, and as a nurse, you got to prevent your patient from fracture. Are we clear? See how your wording changing? Patient has pathological fracture. Why does the patient has fracture? Because the bones are very weak. So which patient would have pathological fracture? Those patients are admitted and they have osteoporosis, they don't have enough calcium, and they are risk for, or they are taking. What is the drug would make the bones more weaker? Which drugs are? Which are the drugs can make your bone weaker? Your steroids, very good. And which patient you will monitor for fracture? Your Cushing patients. Why? Cushing patient has what? Low calcium. Remember the word steroid. So anytime your patient has steroid, the risk for fracture. So what do you do as a nurse? We are going to prevent the fractures. So everyone is okay? The kinds of fracture, which one will lead to your infection when the skin is open? And they give you the wording. Patient fell and patient has abrasion, or a skin is open and patient is bleeding, and what would you do? Yes, of course, first thing you want to stop the bleeding, but remember, when the skin is open, abrasion word, first answer, you're cleaning the skin. Are we clear? Not irrigating word, washing, cleaning, even plain soap and water you can use it, but wash the skin. What are we preventing patient here? Number one is from infection. What is the word is infection is called osteomyelitis. Everyone is okay? The types of fracture is important to know the word compound fracture. Are we clear? Pathological word. You got to prevent your patient to get the fracture. I will move on. Symptom of fracture. What are the symptoms of fractures are? Number one, you have disalignment. Now, not only simple word redness, swelling, pain, but what is you will see in the patient if you have fracture? Your bones are alignment. What happened when the patient had fracture? The legs will not be in proper alignment. Proper positioning will not be the same. Everyone is okay with the word disalignment. Number two is shortening. What leg gets shorter is the hip. Write down the word. Patient fell and patient has hip fracture. So whatever the side of hip is going to get shorter. But remember, if they're saying shoulder got dislocated, it doesn't get shorter, but it gets longer. Are we clear? So remember, seeing the question is shorter. Which one is shorter? Write down like on a hip fracture. But which one will get longer? More on dislocation on the shoulder or shoulder fracture. So patient is having a fracture. What do you monitor? Number one is disalignment. And number two is shortening of the leg. Everyone is okay? What are you looking for sign and symptom? And I'll tell you, these are the way your questions are going to be. So number one, disalignment. Number two, shortening. Number three is the word crepitation. Crepitation means like a rubbing sounds. It's moving. And number four is swelling. Very important, the word is swelling. There is a swelling, there's a bruising, there's edema, but do not forget the good wording. Dislocation, shortening, disalignment, shortening, And 4-1 is swelling. And number 5, I want you to add there, external rotation. So what is the leg would be? Rotation. Now, I want you to remember, these are very important because your question would be, patient fell and patient has a hip fracture. What are you going to monitor? So number 1, disalignment, shortening, rotation word, and pain and swelling. Now, next is, I want you to go to the next page now, and we will talk about the treatment. What do you do? And they give you, your patient fell and patient has a fracture. What do you do? So what treatment do you do? The first thing is, your answer immediately, you assess your patient. Are we clear? You're going to assess. You don't want to move right away. If your patient is laying on the floor, you want to call your RN and make sure you are assessing your patient. But what do we do? The first thing is, underline the word, is splinting. And on the splinting, I want you to write down the right wording, immobilization. So what are you doing? Immobilizing. Why? You don't want them to move around more and get worse with the fracture. And I'll talk few more complications coming up in the next part. So what do we do? First thing, your patient fell, immobilize them. Are we clear? After your assessment, and they may use the word splinting, because you may use something, what? A splint to immobilize. So splinting word, you are immobilizing, and immobilizing is your good answer. And I want you, after that, you write down on there, elevating is good, but what do you do when patient has open fracture, compound fracture? Then your answer will not be immobilizing first. What would be your first answer now? Compound fracture, clean the wound. And how? Clean with soap or soap and water, or if it says wash it with water and soap, that's okay. But what is the second important thing here is cleaning of the wound. But how do you apply this answer? How do you do for your patient? If the wound is open, you clean the wound first. If the wound is contact and it's a simple fracture, then you do immobilizing. What is important after you immobilize your patient are medication. Number 1, pain. Very important, you assess, so maybe add there pain medication. Heparin. Lot of questions would be, they give them heparin, they can give them muscle relaxant. And why heparin is for clotting, right? So heparin is given to prevent from clotting. So everyone should know the type of fractures we have is simple and compound fracture. Simple fracture, you don't worry about cleaning. So as you move on, you need to look your sign and symptom of fracture. Where is the patient has fracture? Immobilize your patient. If there is an open fracture, cleaning of the wound. Not irrigating. You don't have a syringe, you can't irrigate there. So what are you doing? Just simply washing. So there is a difference between washing and irrigating. Now I'm going to move on. The word is traction. What is the meaning of traction is, we are putting a patient in the traction, and what is the meaning of traction? When they're using the word in traction is, number 1, manual. When you see the word manual, manual means by hand. There is no surgery. And what have they done? They fixed the fracture and they moved the position and they're keeping the splint. So a patient has fracture and fracture has been fixed. Manual means by hand, no surgery. Are we clear? That means fixing, positioning of the bone. Manual means by hand, they're fixing the bone. Number 2, what are the kind of tractions we have? A skin traction. What is the skin traction we have with a patient here is buccal traction, cervical traction, pelvic traction, and Russell traction. Everybody has your Saunders book. On Saunders book, when you guys go home, there are the pictures of traction. So if you guys have forgotten, make sure you look the types of fractures, and you do have the pictures on skin traction. But you must remember the word bugs traction. So this is the far you can see, but these are all the traction, and skin traction comes under your bugs traction. So when there is a question, patient has a bugs traction, meaning is patient has a skin traction. Patient has a Russell traction, meaning is what? A skin traction. We got to know as a nurses what are the types of tractions we have. So what is on skin traction is bugs traction. What is in pelvic? Maybe there's a dislocation here. So they're putting a sling and they're applying the traction. That is called your pelvic traction. Russell traction is for leg. And Russell traction is basically they have a sling which is going under the knee. So the leg is already immobilized, but they have a sling which is coming under the knee. So remember, in Russell traction, what do you monitor? And write down under the knee area for circulation, and it's called popliteal space. So remember the word popliteal space. So we all need to know the types of traction. One is skin traction. Number two is the next one is a skeletal traction. What is a skeletal traction means? They are fixing the bone, but what are they putting inside there is the pin. Everyone is okay? Skin traction directly applied on the skin. There is no nails, there's no pins there. But in a skeletal traction, what are they putting here? The nails here. The pins are put it in to fix the bone. So underline the word pin. The word may be tongue word, wire word, pin word. Those are all your skeletal. 90-90, balance suspension, crutch field tongue, traction. These are all yours, both a skeletal traction. So remember, everyone, manual work by hand. Skin traction means the traction is applied on the skin and you will be worrying about the skin care. Are we clear? So if they ask you, you have a patient with bugs traction or Russell traction, what are you monitoring? The skin care. Russell traction, I told you, under the knee area, you need to monitor. What do you monitor in skeletal traction is the pin. Underline that word. And what would you do in intervention? Underline that word. Monitor what side? Pin side or insertion side. So where it says the word insertion, you can add there the pin side. So what are we monitoring here is the insertion side for what? For redness, for swelling, and for any kind of drainage. Purulent word is a pus. If they're saying patient has a purulent drainage, that means patient has infection. And what would you do to do the wound care? I want you to add there the wound care. How do you do the wound care? You must remember the word a sterile technique. Sterile gloves. And follow the doctor's order. You're cleaning daily with normal saline. Maybe he has ordered to apply ointment around it. And so, but it's very important on a skeletal traction, you're monitoring for the drainage and monitoring for the infection. Now, what else do you monitor on underneath in intervention? I want you to remember and write down there underneath when your patient has traction. Now, what do you think patient is doing when they have a traction? Can they move around? No. They're laying in a bed. They can't move around. And so what is the risk here? The skin breakdown. Are we clear? So they're laying. What area is more getting pressure here? Is your back, your shoulder, scapular area, your heels of the good leg also, because what happened when they move, where do they put pressure? On the good leg. So remember, any question is there. You are assessing the skin care. Are you going to give the back care? Yes, because they're laying on the back. How do you do the back care? Is patient must have the trapeze. Are we clear? And patient is lifting and you're taking whatever you're going to do. You're going to wash it, take your hands, go underneath. but you don't want to turn them. Avoid turning when you're changing linen or when you're cleaning their back. But what are you assessing? Circulation. What are we assessing? The skin care. How are we doing the changes of the linen? Patient is moving and you go from the bottom, or you're going from the top but you're not turning your patient. A special bedpan is called fracture bedpan, and you're using for patient because the regular bedpan is very higher and is rounded. The fracture bedpan is very small at the bottom, so when you're sticking it in, it doesn't hurt and doesn't cause much pressure, and you can give them the bedpan. Now remember, patient is laying in bed and they had a fracture. What are we giving all the time? Pain medication. What does it lead to? What does it lead to? What would you be monitoring your patient who's laying in a traction, they're not moving around? We said already the skin care, number one. Number two, what would be important here is constipation. You're giving a lot of pain medication. Constipation. Do you think they should get regular stool softener? If somebody are taking so much of medication, what does it cause? It causes drug-induced constipation. Are we clear? If they're taking a lot of pain medication, the word is what? Drug-induced constipation. And you already know, patient has not much exercise. They're not moving around. Maybe patient need a stool softener. What are you assessing patient? Make sure they're having regular bowel movement. What is the next problem? UTI. Lot of question can be number 3, UTI. Why? Because remember, when you're laying down, you don't want to have them Foley catheter. They're using the urinal, male, female, we are giving the bedpan. But what happens when you give the bedpan and you're laying, you cannot empty a lot of time or completely, and small part of the urine is staying, and also not drinking enough fluid can lead to UTI. Everyone keep those things in the mind whenever your patient is laying in a bed and they're taking a lot of pain medication is going to cause them what? Constipation and UTI. Everyone should make sure we know. We already talked about how to change linen and what to do. It's an all nursing intervention. Next one is, it says about traction. I want to explain what is the meaning of traction. Traction means is pull. Write down the word. We are pulling in 2 directions. So what is traction is? Pull in 2 directions. What are the 2 directions you have? Pull on 2 sides. One is patient's weight is hanging, and the other side is the patient's own weight. Are we clear? So you are laying here, other side you are having a weight. So what happened? What is the traction is doing here? It's not fixing more the bone, but what does it do? What is the purpose of traction? Immobilizing. Number 1. Any question? Why do you apply traction? Immobilizing. Second thing, to relieve the muscle a spasm. And what happens slowly when you are pulling the bones are coming in what? Proper alignment. So what are we doing? Why do we apply traction? It's not there. You guys can add on the side. The purpose of traction are immobilizing and relieving the muscle a spasm. Any question on that? Why do you apply the traction? To relieve the muscle a spasm. And what is you are monitoring as a nurse? If they ask you and they throw the picture, you must be able to know what are you monitoring as a nurse when patient has traction. So remember, when you are having a traction, the rope is coming over the bed. And what is hanging here? The weight. And the weight must not be touching the bed. Anything is touching the bed, you are not getting enough traction. Now you have it here. In your underneath traction, the weight must be hanging freely. So I will just give you a little example. This is a patient's bed here, and you have the trapeze, which is going over the pulley, and the weights are coming down here. If this is a patient's bed, these weights are hanging, but they shouldn't be touching the patient's bed. Are we clear? So weight are hanging freely. If they ask you, how would you document patient who is laying in a traction? Your answer would be, weight must be hanging freely. If these weights are touching the bed, you're not applying the traction. This is the rope which is coming from the patient, and rope should not have any kind of knot and must be on pulley. Are we clear? So rope must be on pulley and it should not have any knot. And they give you the question, patient has been in bed and the rope is having knot, what do? You need to notify, because why? You're not getting enough the weight. Do you change the weight on those traction? No. It is all by the physician. We do not touch the weight. We check the patient and we give our care to the patient. Everyone is okay to know what his tractions are. You are applying to pull the muscle, relieving the spasm, and second purpose I said to immobilize. Everyone is okay? What are we doing here? Immobilizing. So we are immobilizing the leg and relieving the spasm. It doesn't mean they have done the surgery. Maybe surgery may be done later to fix it. The whole purpose is of traction to immobilize and relieving the muscle spasm. And what are the two kinds of tractions are? A skin traction and a skeletal traction. What do we monitor as a nurse for a patient with the traction are? Number one, skin care. If you have a skeletal traction, you're monitoring for the draining. And what do you monitor? The weights are hanging freely, patient's feet are not touching, and the weights are not touching to the bed. And what is important, the patient should have on the bed are the trapeze. Trapeze are very important, and the fracture bedpan, I said you will need it. And remember, is what kind of exercise are you giving to the patient? Are you giving range of motion? No. You can give range of motion, the leg patient has the fracture. What is the exercise we give them? Is called isometric exercise. I want you to remember the word isometric exercise. What is isometric exercise? Contraction and relaxation of the large muscle. Family member is giving range of motion to the patient leg. Is not good. You got to tell them no. And you cannot give, and they ask you what exercise would you give your patient after they're laying in a traction. You can give on the other side, they can move, they're already moving, they're already using the trapeze, and main thing is on the fractured leg is patient, you do not give any exercise range of motion, but other muscles are, your strong muscles are, your gluteal muscles, abdominal muscle, thigh muscle, contraction and relaxation, because you're getting stronger with your muscle. So what kind of exercise, the word you remember? Isometric exercise. Now I will move on the word cast. So everyone is okay with the traction. What are the main complications of traction? Don't forget UTI, I said, and constipation. Next word is the cast. What is the meaning with the cast? Patient come back and they have applied the plaster cast, and there are two kinds of cast you have. Underline the word plaster or fiberglass. What is the plaster? We call plaster of Paris. And those are, why do we apply the cast? Underline the word immobilizing. What are we doing here? Immobilizing. And also keeping in proper alignment. Those are very important words, alignment and immobilizing. You've got to keep the bones in proper alignment. That is the purpose you are applying the cast. Now, if you, number two, first I will go number two, is fiberglass. And synthetic cast is going to dry faster. And within 20 to 30 minutes, you can add there 30 minutes. That means it's dry. And also, this cast is lighter in weight. And plaster of Paris and plaster cast dries more than 24 hours. Are we clear? So that takes longer time. So if patient has A plaster cast, can your patient walk in 30 minutes? No. So you're going to tell the patient your cast is not dried yet, but if you have fiberglass patient, what would be, they can be able to ambulate and that is lighter. Everyone is okay? So which one can they walk earlier? The fiberglass or synthetic one, because that dries faster. And the other one, which is your plaster or Paris or plaster cast, is heavier and also it takes a longer time. Number one, I'll go back on number one now. Patient come back after the cast. Why do we elevate? All elevation afterwards is for reducing swelling. So write down the word reducing swelling. And what will happen if you're reducing swelling? So number one, you are elevating and you're reducing swelling. When the swelling is reduced, what are you cutting down here? You are preventing compartment syndrome. Everyone is okay? What are we preventing here? Compartment syndrome. So number one, very important, patient come back, elevate them, because it's going to be very tight and going to be very much swelling, and so you're reducing swelling, you're reducing the tightness. I will go on number three. How does the cast dry? Very important to understand. We all think we know, but when you will see the question, you will not be able to understand how they're asking you. But everything what I have is very precise. How do you dry the cast? Remember, the cast is drying from inside out. That means don't cover the cast. Are we clear? Don't cover. And when the cast is drying, what is it giving here? Is own heat. So there is a heat there. Number four, how do you handle the cast? Underline the word, not with the finger, but your palm of your hand. So when you're moving, what are you using? Highlight the word, the palm. Number five, turn the patient every 1 to 2 hours to help them drying the cast. So if they ask you, how do you dry the patient cast? Two answers are here, number 3 and number 5. What do? Keep the cast open because you're going to help them drying. And number 5, turn the patient frequently. Everyone is okay? How do you dry the cast? Leave the cast open, number 1 answer. Number 2nd answer, you will say turn the patient frequently. So when you are turning frequently, they're drying up all the sides and it's drying from inside out. Number 7, number 6, how do you position them? Only you pick up the answer with the pillows. They may have sheepskin, they may have many other things, but the best is you use the pillow, even they have been covered with the plastic. It says plastic lined pillow, that's okay. If they didn't have word plastic lined and they have pillow and they have several pillows, that's okay, because you will need pillows for positioning. So don't think, oh, they're saying several and they have another answer, sheepskin. So I gave you lip and cut question. You have those questions there. And these questions are important. How do you position them? Put them on the pillow. Number 7, cool setting. You will only go with hair dryer and can be used to dry the plastics. But what air you're giving? No heat. Remember, they're drying inside. So do not pick up hot air. What do? Cold air. Even at their itching question, patient complains itching, you go with cold air. You can go with cold compress outside and itching medication. Because when you're applying the cold even out, you're not going inside to apply cold. You can go the cold air and they say apply cold compress, that's okay. You're applying outside, that can help them to cut down their itching. Everyone is okay for itching question? Cold. Number 8 is you're monitoring pain, swelling, discoloration, numbness, coldness, and diminished pulses. And I want you to add there, number 8, neurovascular assessment. What are we assessing? Neurovascular neurovascular assessment. So we are assessing neurovascular assessment. So what is neurovascular? Not only the blood vessel, but you are checking sensation. You are checking the nerve. What are you checking? The nerve and the blood vessel. When they are cutting it, the circulation, they're not only circulation, but they are also sensation. Patient cannot feel any pain. Patient is having no sensation. Patient cannot wiggle the toe. That means the nerves are damaging. So what do we monitor here? Neurovascular. And you can say swelling, discoloration. Now number 9. What is number 9 is word bivalving. What is bivalving? You are cutting the cast to compromise circulation or compartment syndrome. Underline the word compartment syndrome. Patient says, they're not having a good circulation. A patient has a compartment syndrome. What do we do? The first answer is bivalving. What is bivalving? They're not removing the cast, but what do? They cut the cast on the side just to loosen up so the circulation would improve. Everyone is okay bivalving? Highlight the word circulation compromise. When you see the word compromising circulation, then we are cutting the cast. Next is paddling word. What is the word paddling is here? Putting the tape, write down the word tape. Sometimes they have put the cotton, put the cloth around. No, putting the tape, the word is paddling. When do we use the word paddling? Highlight at the end, smoothen the edge around the cast and write the word irritation. Patient says, I'm having skin irritation. That means the skin is rubbing. Now sometimes your cast can be very rough on the edges. So if it is rough on the edges, what happened is rubbing. Are we clear? So everyone is okay. Is number 10 paddling? I said, what is paddling? They put the tape around because the edges are rough and they're rubbing the skin. Everyone is okay? And patient is saying, is around the edge cast and write down the word irritating. The skin is irritating. The skin is rubbing. Patient says, I'm having skin irritation. What is the meaning of skin irritation? It's rubbing. And what do? Your answer would be paddling the cast. Okay? Now another question. How do you paddle the cast? Put the cloth around it or tape around it? Tape around it. Are we clear? So what do you do here? The word is paddling. Number 11, sign of infection. We all know sign of infection, odor, pain. But patient says, I have a hot spot under the cast. What does it mean? Infection. Are we clear? So what is the sign of infection is hot spot. Clear, simple word. Everyone need to know word bivalving. Everyone need to know the word paddling. Everyone should know the word hot spot. They're going to use those words in your question. Now, if patient has drainage under the cast on the extremity, then what do? It says window word. Cut the part. Highlight the word window. So now I'm talking about window. When you will go for your answer window? When there is a drainage under the cast. What do? Patient says, or patient feel there is a drainage and there is a smell is coming out. What do? They're not removing the whole cast. What do? They only cut the area. And that is called the word. Suppose this part has drainage under the cast, they cut the piece, they take out this, but the whole cast is intact. Everyone is okay? What is the meaning window? That means that area they will cut and they will remove the piece. And why? So you can see the wound underneath. You can clean the wound. You can dress the wound. And another question, after you have done window, what do? You put this part back and you can put the tape around. Everyone is all right? It's very important that we know the word window. So window word is important and underline that. on there. And number 13, I already said the word in the traction exercise, whether you have traction, you have a cast, is called isometric exercise. So everyone must know those wording. I want first thing everyone remember is little anatomy. Your question, I gave you question. Now it's all up to you guys how you are practicing. If you are not practicing question, you are not going to see what we have learned, and you got to do the question. And I'll tell you, you will see how hard you will feel when the questions you're going to do. Now, before I move on that, I want you guys tell me what is this bone is called in the arm. What is this bone here? This part, if you have a fracture in upper arm, what is this bone is here? What is this bone? What is this bone? If you don't know the names of your bone, how are you going to correct your bones? What is this bones are? Anybody remember this bones is called what? Humerus. And what is these are in the front here? What are these two bones you have? It's called radius and ulna. Remember, radius and ulna. What is this bone is called in the leg? It's okay, it's all right. I know we do forget, but that's just the part we got to remember the wording. This bone is called what? Femur, right? What is in the leg? Tibia and fibula. Now let me tell you, if you are saying, they are not looking just wording, they really know how to test your knowledge. And if they give you the word patient has fracture in the leg, and what is the bone we said here? Tibia and fibula. Patient has tibia fracture. If you don't know where is tibia, how are you going to immobilize, right? So remember, tibia and fibula is in the leg. Now what happens if your tibia is broken? How are you going to immobilize? How would you immobilize? What is the meaning immobilizing?
Keep it straight.
That they shouldn't be able to walk and shouldn't be able to move. All right, so how do we immobilize the bone if you have fracture here? Or if you have fracture on your ankle? How would you immobilize your tibia bone? From where to where would you keep the splint? Where do you keep it? Under the leg? And what area are you covering? What area are we covering here? Is, remember, that's your foot. Are you going to go below the leg? Yes. If you're not going to support the leg and ankle, so where is going to be your splint? Your splint has to support your foot. So you're going below where? Ankle. Are we clear? What is this bone is here? Ankle. So your splint should not be above the ankle. Why? If you don't have on the ankle, what happened? You're still moving your foot. If you don't have your splint above this area and above the knee, what will happen? The patient is able to still not immobilize. So remember, any time when you're immobilizing, you got to immobilizing the below part. And what is the below part you have? Is the ankle. What is the bones are called in the foot? What are the bones are called? Metatarsal. If they're asking you how do you wrap the bandage and you have a fracture in the ankle, where do you start the bandages? You start the bandages on metatarsal. Are we clear? Now, if you are not covering the metatarsal and you are not going around ankle, your ankle is still going to move. So keep that in mind. I would ask you, you will be surprised when you will do the question in Lippincott, you do have the bones. So everyone, this is humerus, radius, ulna here. And what are the legs you have? On the legs you have tibia and fibula. So if they're saying tibia fracture, you have the leg. What is the foot is called? Metatarsal. What would be, you will be called, the hands would be for immobilizing. Remember, is carpal. Metacarpal. Are we clear? So you got to remember and look through your little bit anatomy. And even if you do question, you're going to find those answers and immobilizing. If you're putting a splint just below the knee, you got to go above. Why? Because you want to hold this part and you want to hold there. And there are a lot of questions are triangular bandages and circular bandages. How do you apply them? So I would advise you, because we are nurses, we do the bandages. If we don't know where are we putting the bandages, how can we do our patient care? So we must know some part of the bones. And what is the scapula? Is this part, the shoulder. Where is your clavicle? Right here. So we know this is the cranium, and this is your clavicle here, scapula here. Then we must know when they're saying tarsal, metatarsal, carpal, and where they are. So that I wanted to remind everyone that's important. Now, I will move on before we go on break, is complication of the fracture. Very important. We all know the complication of fracture. Number one are the complications are compartment syndrome. Complications are compartment syndrome. What is compartment syndrome? We all know what is, but how do you define? So let's highlight the word pressure. It comes from pressure, resulting the pressure within different compartment. What are the different compartments are? Blood vessel, that means it's affecting the blood vessel, muscle, and the nerve. Everyone should know what is it affecting here? Blood vessels, nerve, and the muscle. So remember, all are damaging. 3 different compartments are damaging. So we are not only looking the circulation, that is why, what is the best word I said? Neurovascular assessment. Then we will go underline the word neurovascular. And what does it cause in that area? The word is ischemia, lack of blood supply, ischemic. Then you go, the word is 4 to 6 hours. Within 4 to 6 hours, patient would be irreversible damage. And what is the meaning irreversible damage? Patient may go for amputation. Lost the whole circulation. Area is bad. So, as a nurse, don't ignore it. Patient says, I'm having a problem, and you see there's a lot of swelling. Patient cannot wiggle. Their circulation is cutting off. You've got to do something. Don't wait, I'll see tomorrow. Maybe it will get better. I'll put the pillow, and it might help. But no, don't take chances, because it takes quick time to damage the area, and once it's damaged, it's irreversible damage. And if patient has damage, who's going to be in fault? Us, because we did not monitor. Doctor don't send you the patient and say, make sure you monitor compartment syndrome, make sure you turn, no. They're sending patient to us. And we are the one who plan the patient care, and we plan the patient to prevent them from complication. Number 2 is, underneath it says 5 P's in compartment pain. What is 5 P's are pain? Second word, pallor. P-A-L-L-O-R means pale. Pulselessness. P-O-L-A-R, cold. And paresthesia, no sensation. So it's just to remember, but remember, very important word is what here? Compartment syndrome. What is important here is cutting off the circulation, irreversible damage, and we must do something, and we are monitoring what? Neurovascular assessment. Next page, you will go, if there is a compartment syndrome, what is the treatment for compartment syndrome is? Number 1, we already talked about bivalving. What is bivalving is cutting the cast on the side, and what is it making here is loosening up the area and improving the circulation. Are we clear? So what is that means is cutting the cast and causing, which is causing the pressure. Number 2, so compartment syndrome, first thing we said bivalving, everyone. So when I'm done and you guys are going for exam and I'm reviewing, I want everyone to remember what is the compartment syndrome is the treatment you do is by valving. First you cut. Second thing is fasciotomy. What is fasciotomy is done by surgeon. It's a surgery. And what are they removing? They're giving incision. And remember, I said we have epidermis, we have dermis, and after the dermis is what? Subcutaneous tissue. So they're going deeper and they're removing the dead area and fascia. Why? Underline the word to relieve pressure and improve circulation. I want you to write down one more word for circulation is perfusion. What is the word perfusion? Is always circulation. So if they didn't give circulation and they have, what is it improving here? Perfusion. Perfusion means circulation. So what is fasciotomy? You're removing all the dead area because why? Your wound is not going to heal until that area is removed and the circulation would improve, healing would take place, and patient would feel good. So your surgery would be done. So what is the first complication? Compartment syndrome. Everyone is okay? What are the treatments we have? Fasciotomy and bivalving. Number 2, osteomyelitis, very important. And so perfusion word, Perfusion. What is the second complication we have is osteomyelitis. What is osteomyelitis? Infection. How do you prevent your patient from osteomyelitis? How do we prevent the patient is from osteomyelitis? You're okay? Perfusion word, okay? And what is osteomyelitis? How do you prevent? Clean the wound with soap and water. Washing your wound is number 1. Patient fell, patient has open wound. Read your question properly. And what do you do here? Clean the wound. And what happened? The infection is gone into the bone and is leading osteomyelitis. What do you do for a patient who has data collection? What would you see in your patient? Number 1, they have fever, tachycardia, white blood count is high. Leukocytes, write down white blood count, CBC, ESR may be high, drainage is there. Patient is having fever, patient is having swelling. So what do we do here? Culture and intervention. Right away you do the culture. Why? Because you can give proper antibiotics. So second thing, how do you treat them is by giving IV antibiotic. Everyone is okay? How do you treat osteomyelitis? IV antibiotic after you do the wound culture. If there is no drainage, maybe they're going to do the blood culture, wound drainage culture, and you do not give oral antibiotic because infection is bad and it's going to go all over in the body. How do you treat? Number 1 answer, IV antibiotic. Then you will move on. You can give them and long term. Not only patient is admitted for 1 day. Patient says, I'm going in the hospital, I'll get antibiotic and I'm going home. No, patient doesn't understand. Patient may be in the hospital for longer term. That's your teaching question. Now patient is going home, you will be teaching them how to give antibiotic. Because they are going home, antibiotic will continue for some longer time. So remember one word, osteomyelitis, cleaning wound is important, IV antibiotic, culture is important. How do you give antibiotic? IV. Patient is going home, we will continue teaching patient how to give their own antibiotic. Next answer is, for wound healing and bone healing, we have hyperbaric oxygen. What is the meaning hyperbaric oxygen therapy? They're covering that area and they're giving, and I want you to add there, 100% oxygen. How much oxygen do you give for wound healing or hyperbaric? 100%. And it helps them for healing of the bone and the wound. That's another treatment in the wound care and the bone treatment. Number 4, if the bone is bad, and is necrotic. What do? Squasterectomy and bone grafting. And number 5 is, so squasterectomy means is the surgery, bone grafting. Continuous sterile dressing technique. Patient has infection. Immobilizing the area. Patient is going home and teach them how to give their antibiotic and monitor their sterile technique at there for wound care and monitor their temperature at home daily. If the temperature they're running, that means they still have infection. Wound care diet, always you increase protein and you increase the vitamin C. I think we should take a break, and I'll say the next one, the last, is